Okay, our next presentation is on, okay, wait a minute. Teresa McGeeney, she's a PhD and an epidemiologist at Reach Evaluation and McKinney Consulting Partners. And she's going to provide a presentation on new Kentucky behavioral health data tools. So with that, I think she'll be joining us on Zoom. I see her there. Hi.
Hi, yes, how are you all? Teresa McGeeney, so sorry I couldn't be there in person today. I was planning to be there and then we had a change in childcare this week. So kind of turns things upside down. But anyway, happy to be here with you virtually. I'm going to be sharing a couple different tools for new behavioral health tools. One was one that we completed last late summer, early fall. And that is a dashboard of behavioral health indicators. And then the second one, I'm sure many of you are familiar with the KIP survey. And we have been putting out a series of infographics with the most recent KIP data. And so that'll be the second piece that I share. So first, I'm going to share my screen. And if you all can let me know that you see it, I think I can see it. I can make it out on the screen. So anyway, here is the behavioral health dashboard that we developed in partnership with the Department for Behavioral Health. So this is the purpose of developing this dashboard was to support the regional prevention centers in their needs assessments that they have to do every few years. And so, we were trying to gather a bunch of data, data from different data sets, including some from KIPRIC, some from public health surveys, some from the KIP survey, just wherever we could find, some from KSP, wherever we could find data that kind of paints the picture of behavioral health and on a county level, because that's what we really heard that was needed. So that's what we tried to do with this dashboard. So I'll just kind of walk you through the dashboard itself. On this homepage, it has a little blurb and description, tells you to select a county. I've selected Franklin County because that's where you all are, and then kind of gives some instructions. And then there are tabs on the side that kind of walk you through different topic areas. And so the first two, demographics and social determinants of health, serve to kind of provide some contextual data to all of the additional data that we'll share. And it really tries to tie in. So on this page, we have demographics in your region and in your specific county. So age, race, ethnicity, sexual orientation, some of the indicators we don't have on a county level or even a regional level. So any of those are just noted. Immigrants and military. And then each of these kind of little blurbs under the different topic areas tie that into how is this relevant for behavioral health. We know that, for example, age, we know that certain substances, the use of them peaks in, young adulthood. An accidental overdose, for example, peaks to, in young to middle adulthood. Suicide risk peaks to late adulthood. So it's just kind of, we wanted to share data to kind of ground you in what does this county look like? Because, for example, if your county has a lot of, older adults, then suicide may be more of a risk for those residents. So that's kind of the purpose of the demographics tab, as well as the social determinants of health tab. It's, similar things: poverty, employment, COVID deaths, mental distress, and educational outcomes. And at the bottom of every page, including these first two pages, we have any of the data points that we have. So basically, we're portraying any of the county level data only within the regions, and the regions that we're using are the RPC, or Community Mental Health Center region, which are very, very close to the ad districts. There are a couple differences, but at the very bottom of the page, for any of the data points that we have county level data, you can portray it on a statewide map as well. Yeah, so all of these are just kind of on a regional map, or if you need the state map, you can scroll all the way down. So then we have data on every single, or sorry, not every single substance, but a number of substances that the state identified as priority areas: nicotine, alcohol, cannabis, opioids, stimulants, and then suicide as well. So on these pages, we have this first section opens with kind of national trends in that substance, to kind of, again, contextualize the data that we're about to look at. You know, what are the, you know, where are we seeing, and then connect it back to those other demographic data, for example. So looking at nicotine, we see that, you know, vaping, for example, which are portrayed in these green bars, vaping rates peak in, you know, young adulthood. And so if, for example, you found on the first tab that your county has, you know, a younger population, that might make sense to, you know, to prioritize. So that's kind of the thought process why we've included both these contextual data and then trying to tie them back on these, you know, particular topic area pages. So, you know, we show just a couple highlights and kind of summarize national trends more broadly in this paragraph. Then we talk about nicotine use in your region. And so then we address how, you know, this region, which is New Vista region, how it compares to the rest of the state in a bunch of, you know, nicotine metrics, and then kind of summarize it all. So New Vista for this one has moderate to low nicotine use rates compared to the rest of the state, and then kind of give examples of that. I will note, you know, at the end of this paragraph, it says, though New Vista's rates are, you know, kind of rank on the lower side for Kentucky, Kentucky ranks very high, which all of you all know, for especially for cigarette use. So it's kind of just trying to paint a picture of, you know, where does a particular county rank, and, you know, how does this substance, what is the substance use looking like in that county, and then how does that region stack up in the whole state, and then how does the state stack up in the whole, you know, in the whole country. But for the specific substances, we've tried to get a number of data points, although trying to not keep it too overwhelming, for consumption data, so current, you know, nicotine use among adults, and youth if it's available. Apologies, this graph got a little bit, the map got a little bit squished, but all of Kentucky is there, and you can kind of pan over or adjust the screen accordingly. And then also consequence data, so looking at cancer rates, COPD, and then as well as risk and protective factors. So for example, smoke-free ordinances, if the county selected has a smoke-free ordinance in place, the details of it are shown above. So this one has one for Frankfurt and then one for Franklin County itself. And it provides details on what level the ordinance, you know, regulates. And then again, we've got the county level indicators you can view on a statewide map as well. So I won't click through every single page, but I'll click on opioids because we've got some, since it's a controlled substance, we've got some additional data on there. But again, we've got these national trends, painting the picture of what's happening in opioid use in general, and then opioid use in your region. For here, we have non-fatal opioid overdoses, youth opioid use, or misuse, pardon me, admissions to for substance use disorder treatment clients, and heroin and morphine substance use disorder treatment clients. We also have arrest data, with a note that arrest data is imperfect and it will really vary depending on policing practices. A good example of that is in several years ago in Louisville, they stopped arresting folks for carrying cannabis, but trafficking is still, you'll still be arrested. So, but that will really impact, the arrest data, obviously. So yeah, that is, let's see, I was going to click on the suicide data as well. But similar, layout, obviously. And for suicide data, we've also got mentally unhealthy days, depression among adults, and then youth suicidality, and then hospital visits and emergency department visits, and then suicide deaths. So that is the first dashboard, and I will take a break from talking to see if anyone has questions or if you all want to see anything in particular before I move on to the other.
Questions?
Okay, well, in that case, I will move on to the other thing I wanted to share, which is some infographics. So REACH has been very excited. We've added a number of questions on the KIP survey, and we have some really great data for the 2021 survey. And so one of the priorities this year has been producing infographics, sharing the results in kind of easily digestible, easily shareable formats. And so we have a survey for the KIP website, or for the KIP survey. We have a website for the KIP survey. If you're not familiar, it's just kipsurvey.com. This is what the homepage looks like. And if you click Explore KIP Data, you can, the first option under there is KIP Infographics. And so if you click that, I'll show you a few of these that we've been working on. So the first one that we worked on was the impacts of the COVID pandemic on behavioral health. And I'm not going to read all of this, but just to kind of paint a picture of what data we collected and what data we're portraying. Mental health impacts. 1 in 4 middle school students reported having poor mental health most or all of the times during the pandemic. And 1 in 3 high school students said that they had poor mental health. LGBTQ students, including gay, lesbian, and questioning students, as well as students identifying outside of the gender binary, were substantially more likely to have poor mental health during the pandemic, as well as multiracial students. They were the most likely group of all of the races and ethnicities. Substance use impacts. In general, substance use decreased during the pandemic, but there were some students who said that their use increased, and there were some students who were more likely to say that their use increased. Again, LGBTQ students were at an elevated risk of saying that they used more substances during the pandemic than before the pandemic. And among those, this is an unsurprising connection, but important one. People or students who used substances before the pandemic, students who used substances were more likely to report poor mental health, and that relationship was very close. So like if you reported poor mental health, then you were more likely to say that your substance use increased during the pandemic. And then at the bottom, we have a call to action. These steps are taken from the Surgeon General's report, just about how we can better support youth behavioral health. And then at the very bottom, we've got our references here. Any questions on, I'll take a brief pause on this one for any questions on this infographic looking at COVID. Okay, moving on to the second infographic. This one focuses on racial inequities and the impact of racism on youth behavioral health. And so this was something we were really excited to have in 2021 for the first time. We asked two questions with several sub-questions about their experience of racism and concern, race-based concerns and experiences. So we're excited to have that data and to have it to share with you all. So this first section looks at mental health and substance use, broken down by different race and ethnic identities. We see that multiracial students and Native Hawaiian or other Pacific Islander students had the highest rates of psychological distress compared to other races and ethnicities. And then looking at that multiracial students a little bit more closely, among 10th graders, 1 in 4 of them had said that they had cut or harmed themselves on purpose. 1 in 5 seriously considered suicide, and 1 in 8 actually attempted suicide. And then these are just kind of other disparities, comparing each of these different racial and ethnic groups compared to their white peers, showing the elevated risk of these students of color. And then again, looking at substance use, we see again this multiracial group at an elevated risk for reporting substance use for alcohol, cannabis, and vaping. And then AI and AN is American Indian and Alaska Native. And sorry, the abbreviation is over here, but American Indian and Alaska Native were more likely to use alcohol and vaping, and Black students were more likely to report cannabis as well. The next section looks at the impacts of racism. So this first graph just shows the percentage of students who said that they had been a target of racism broken down by race and ethnicity. So you can see all students of color had elevated risks compared to white students, and unsurprisingly, Black students had the highest rates, followed by Asian American students. And looking at mental health, students who reported being a target of racism were substantially more likely to report psychological distress and suicidality, as well as substance use. So about 2 or 3 times as likely for both of those topic areas. And then we have high percentages of students of color reporting that they, feared for their safety because of their race or culture, or they experienced stress because they worried they would be a target of racism. And then finally, again, at the bottom, we have a call to action about, recognizing racism and the impacts on public health. How can we support youth? And what actions can we take? And then sources, and as well, for this one, we added some additional notes, and one big caveat to the race-based data is that Jefferson County, which is the largest school district in the country, or in the state, it is actually one of the largest in the country, but it also has, the most Black students in the state. Jefferson County did not participate in 2021. Fayette County, which is the second largest, did participate in 2021, which is great. But our representation of Black students in particular decreased a little bit in 2021. And the representation of Hispanic students actually went up a little bit in 2021. And we have some additional, just notes to consider, and then some additional resources at the bottom. Any questions on this infographic on racism before I move on? Okay. Finally,
we have a question.
Yes, go ahead.
Okay. Hello, I'm Sonia with Echo out of Jefferson County. And my question is, so based on the data that you've received as far as with the mental health and the substance use, have you researched to see if there is a correlation or a connection of children that have been abused?
That's a great question. I think prior research definitely supports, a connection there. We do not ask questions about abuse per se. We have some questions on the survey related to peer victimization at school. So asking about whether they have been, and we actually do have a couple questions on like dating violence as well. That would be kind of the closest that we get. But we don't have any, there's always, every year that we do the survey, there's always kind of a conversation about what questions to add, what questions to take off, and that type of thing. We have talked about in the past adding the ACE scale, the Adverse Childhood Experiences scale, that would kind of get at some of that. But that was not, we didn't do that in 2021. So we don't unfortunately have that data to look at.
Yeah, I'm just curious to know how all these components work hand in hand for kids, because if we're seeing mental health issues increase and substance increase, and specifically with suicide, what is the underlying root cause as to why our kids are doing this? And a lot of times it happens to do with what happened in their childhood as to why, they may venture off into some of these other areas. So that's the reason why I was asking.
Yes, I completely agree in terms of, yeah, that would be excellent data to have. Part of the consideration in terms of, do we want, just considering which questions to add to the survey. The survey, it includes students of 6th, 8th, 10th, and 12th graders. And particularly for that youngest group, there has been some concerns about the survey content and the sensitivity of the content. And so I think that was part of the concern with the ACEs scale, but I don't know, we always revisit these things every year. I do note in the chat, more than one root cause is always present for suicide and other mental health issues, absolutely, which I think is, speaks to your point of why it's kind of important to gather the whole picture, as much as the whole picture as we can. But yeah, I agree that it would be great to have data on that. So maybe sometime in the future, we'll see. Thank you for the question.
Any other questions? I'm not seeing any.
Okay, well, I'll move on to our last infographic, the state of youth mental health. So this is kind of a more broad youth mental health infographic in Kentucky. And this shares that, just kind of an overview at the top. 22% of participating students in grades 6th, 8th, 10th, 12th reported serious psychological distress in the past 30 days. And 8% reported attempting suicide, 11% said that they had planned suicide, and 14% said they had considered it. This little box right here shares kind of the trends that we're seeing from 2014 to 2021, because they have been substantially increasing, particularly for serious psychological distress. But you can see all serious psychological distress and all of these suicide indicators have increased significantly throughout, the past several years. And sixth graders have seen the largest increases. So, and their rates of suicide ideation and suicide planning more than doubled from 2014 to 2021. In terms of, let's see, these are just some other prevalence data. 1 in 6 students reported engaging in self-harm behaviors, and 1 in 3 students said that they had poor mental health most or all of the time during COVID. Compared to their peers, again, these LGBTQ students, by sexual orientation, gay, lesbian, and questioning students were, 3 to 5 times more likely to report suicidality. And students outside of the gender binary were, again, substantially more likely, between 4 and 7 times more likely to think about and attempt suicide. And again, that multiracial group of students had the highest likelihood of reporting serious psychological distress and suicidal ideation. Here we're portraying race-based concerns. So this is the percentage of students who said that they worried that they would be treated differently because of their race or culture, broken down by race and ethnicity, and Black students, followed by Asian students, followed by multiracial students, had the highest rates of that concern. And then, again, the connection between psychological distress and substance use, the likelihood of experiencing psychological distress was increased among students who vaped, used cannabis, binge drank, and used cigarettes. So anywhere between 2 and 3 times more likely for all of those outcomes. This section talks about a trusted adult. This was another question that we added in 2021 that we were, again, really excited to have data on. Numerous studies say that, that one good adult in someone's life can make such a substantial difference. And you can see the stark differences here. The red bars show students without a trusted adult, and the green bars show those with a trusted adult. And for serious psychological distress, suicidal ideation, planning, and attempt, you can see how much of a difference that that trusted adult is associated with. And then again, LGBTQ students are at an increased risk of not having that trusted adult in their life. About 50%, more than 50% less likely to have somebody that they trust in their life to talk to about difficult things. Mental health outcome. So then we looked at social media. Frequency of social media use. This first part just shows how frequently students are using social media. And then as the frequency of social media increased, so did psychological distress and suicidality. Similar portrayal of the results with sleep. Excuse me. So this shows the percentage of students by grade who are getting the recommended amount of sleep. And you can see that peaks in 8th grade with only 37% of students getting the recommended amount of sleep. And then among high school students, those students who got the recommended amount of sleep were less likely to report psychological distress and suicidality. And then finally, how can we support, youth mental health? This is our kind of the action steps section again, and then some resources as well. And I am noting in the chat, Marcy shared of note, being LGBTQ plus doesn't qualify as a mental illness, rather the environmental, political, cultural concerns they face impact their mental wellness. Absolutely. Thank you so much for that clarification, and my apologies if anything I said kind of excuse me, muddied that water. The same with the, the race-based data as well. None of these, associations here that we're sharing are because of something inherent to the student. It's about, how that student is treated because of these, because of these characteristics. So anyway, just wanted to make that clarification as well. Thank you for that note, Marcy. And we do have, I believe on the race-based infographic, we may have a note on there about, this is not due to inherent differences. These are, this is due to racism and homophobia and those types of things that that these individuals face. Those are what drive these disparities. So any questions on this one? Or any of the others that I've presented?
Any questions? I did have one question. Is there any thought of doing this kind of as a regional? I assume this is all statewide, but I mean, we are very culturally diverse across Kentucky. I mean, I've lived in Western Kentucky and Eastern Kentucky, and Louisville's different than all the other areas. So I just was curious.
Certainly, yeah. So one of the things, I was going to click around a little bit on the KIP website, and I'll do that now. One of the things that we do have on here is a regional report. So we do a statewide report with every single question on the survey, a statewide trends report. And then we also do a regional report. We don't do every single region or every single item on the survey, but we have a number of items, and we've added to this list every year because we want to break down more and more. Let's see, I'll scroll through but we have some introductory kind of describing the general trends, and then we portray the data on maps. Excuse me. And also provide these trend lines for each of the different 14 regions. So that's one thing we've got. I don't know that we'll be able to do the infographics on a regional level, but one other resource that we have, actually, I'll show you that after this. One other, so this is our statewide trends report. Let's see. Oh, wait a minute. Hold on, see if I can. There we go. Okay, now it's downloading. Oh, no, that's the wrong one. Anyway, I might be lost on our website, but I believe it's on the homepage too. Yeah, statewide trends report. Here we go. So this one is the one that breaks down the trends for every single, let's see. So we've got a lot of introductory text that kind of contextualizes the data, the survey itself. And there we have the breakdown of every single item by grade and by year for questions where we have trend data. So this is the percent of students who said that they had been suspended from school in the past year. And then these different bars represent different years, and these clumps of bars represent the different grades. So we've got that for every item on the survey. We also have some data tools on the survey or on our website. And these do provide some additional regional data as well. So this first one, the KIP data summary dashboard, shows just some key trends and some key data points that we pull out. The percent of students who feel unsafe at school, the number who had carried a handgun, bullying, attempted suicide, And this, you can go back and look at previous years, or you can filter by region and get the data here. We are going to be updating this one as well to kind of fold in some of the newer indicators that are not currently on here. And then, oops, we also have what we're calling the data visualizer that we are also planning on updating with some of the newer indicators. But it allows you to go a little bit deeper. So with substance use, this portrays the trends, and you can again filter by region or grade. Gender is, I would recommend for the 2021 data, since we have not had the chance to update this yet. I'd recommend sticking with all, because male and female will not capture everyone, because we have to figure out how to apply. Our programming team has to figure out how to apply the filters for only years that have the data beyond the gender binary. That was a new addition in 2021. But anyway, we portray the data in various ways, broken down. We've got different tabs for different topic areas. I'll go to mental health, for example, suicide and self-harm. And again, you can filter the data by year, region, grade, and gender, and that will be expanded soon. Excuse me. 'Tis the season for allergies and all. And then finally, we have some additional data dashboards that we have put together. Looking at, this first one looks at race-based experiences and concerns and the impact of racial justice movement, and breaks down the data by race and ethnicity. Let's see if it'll load for me. Well, we may have an issue with this one, but anyway, we do try and portray, as much data as we can on a regional level. Also, every district, I don't know if folks there, how familiar everyone is with the KIP survey, but I would be happy to, excuse me, I'll be happy to kind of give a little blurb about that. Here we go, it loaded. But every district also receives they receive a trend report and a district report, which compares them to their region and to the state. And they also have like that one pager dashboard where the numbers change and everything. That one is available for districts as well. So, we're hopeful that they can use that data however they need. So this just kind of portrays certain questions broken down by race, giving a little bit more detail. So anyway, I think that I feel like I have talked and shown a lot of data. So any more questions for you all, or that you all have?
Have any other questions? I did have one on military connected youth. Are you going to be tracking that as well in future surveys?
Yes, we do. Yeah, we do collect that right now. We have for a few years, and we're planning to do an infographic on that one as well.
Okay, great. Thank you.
Yeah.
Any other questions? Okay, thank you. I don't see any other questions. Thank you, Teresa.
Okay, thank you so much for having me.